everyone. This is Mrs. Barton. We're going to begin with some CPR and first aid. So what we're going to do is a lay responder course. If you do second semester, we can do BLS provider level. But at this point in time, I think the lay responder is the most appropriate. So we need to talk about what you do before you actually provide care to somebody. As soon as you start providing care to them, you now become liable for what happens to them. And you want to make sure that you're making the right decisions and that you're choosing to act when it's appropriate and in the right way. So, when you come across an emergency, okay, there's 4 different things that you should really think about. They're going to make a difference in your safety, your patient's safety, and actually doing good. So you need to recognize that an emergency exists. I give my students the example of, say, a small child. And if mom or dad is laying down in the middle of the kitchen floor, the child may just think, oh, they're laying down for a nap, not putting together the clues that, hey, this is actually not normal. Mom doesn't normally take naps on the kitchen floor, right? So you're going to need to actually recognize that something is wrong, okay? You need to actually take action. If you decide not to take action and you do not seek any further help for the person and they are unable to do so themselves, that is called negligence and abandonment. And those are both punishable by law. And ultimately, we're in this field and we're trying to learn all of this stuff so that we can help people and we can make a difference in the people around us. Right? We need to be able to recognize when it's something we can handle, or do I need to call 911? Do I need to get EMS going to come and help? Right? And then last but certainly not least, this is very important. Always, always, always give care consistent with your knowledge and your level of training. Okay? Because you may be trying to help them, but if you're not properly trained to do something, you could wind up hurting them or potentially killing them. And if that's the case, they can very easily sue you, or a friend or family member can sue you. It just opens you up to the fact that you potentially hurt somebody and some of the legal repercussions from that. So make sure that you only do what you know how to do.
Can you believe they're catching the game last night?
It was amazing. You know, I thought it was over. I was ready to turn the TV off and go to bed.
But they got lucky. They had no business winning that game.
Look, a win is a win.
Yeah. Oh, check him out. That guy looks like he was out on the field.
Seriously, though, you think he's okay?
I would assume so, since he's out and about, but how can you tell? Hello? I gotta get to the office.
Yeah, me too.
Yeah. Okay. We'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Help! Dad, are you okay? Help! Dad, someone help my dad, please.
Sir, are you okay? Sir, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have this at the store. Dad!
It's okay. He's calling 911. Did your father complain about anything before he collapsed? Or?
He was complaining about not feeling well, but he always complains, and then he just collapsed out of nowhere.
Do you know if he's allergic to anything?
Allergies. Aspirin. He's allergic to aspirin.
Does he take any medication? Or?
I don't think so.
Okay, so I want to point out some really good things that happened during that video. So he kind of recognized that something was off about the guy, okay? It's very possible that he could have just ran around the block and he was sweaty and out of breath, but it was noticeable that something was wrong. And then when he collapses and the daughter starts screaming for help, he comes and immediately takes charge. He stays calm. He delegates to other people so he can use his time wisely. He delegates and tells somebody to call 911. And he tells another person to go get an AED and a first aid kit. Okay, and he checked his responsiveness, right? When he's responding but not appropriately, he starts interviewing the daughter to get what's called a sample history, SAMPLE. It's where you interview to get signs and symptoms, allergies, medications, pertinent medical history, last oral intake, and then events leading up to the incident. So that guy did a really great job there. This next one has to do with a pediatric.
Can you believe they're catching the game last night?
It was amazing. I thought it was over. I was ready to turn the TV off and go to bed.
Yeah, but they got lucky. They had no business winning that game.
Look, a win is a win.
Yeah, right. Oh, check him out. We should break out some scooters on the way to work.
I could definitely see you breaking something on one of those.
Yeah, you're right. Hello? I gotta get to the office.
Me too.
All right. Yeah. We'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Help! Joey, are you okay? Help! Help! Someone help my son, please! Joey, are you okay? Oh.
Joey, are you okay? Joey, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have these at the store. Joey!
It's okay, ma'am. He's on the phone with 911. Did you see your son fall?
It all happened so fast, I'm not even sure what happened.
Did anyone else see what happened?
Yeah, I saw the whole thing. He just collapsed out of nowhere.
Was your son complaining about not feeling well earlier today, or?
He said that his stomach hurt. I said we shouldn't go, but he really wanted to ride a scooter. I should have made him stay home.
Does he have any allergies?
No, he has no allergies.
Thank you so much.
All right. So again, he took charge and delegated for somebody to call 911 and sent someone to get the AED and first aid kit. Now, I want you to think for a minute, and why, I mean, the person is obviously breathing, right? If they're breathing, they have a pulse. Why would he want an AED? Okay. Now, it's kind of like a Girl Scout or Boy Scout mentality. You're going to prepare for the worst and hope for the best, because if they're altered, if they're not responding appropriately, it could very well be a serious issue, and it could snowball and get worse and worse. Okay, and the worst it could get is cardiac arrest, right? And that's exactly what we have the AED for. First aid kit is going to have gloves, our personal protective equipment, that is abbreviated as PPE. And also, in case you need to do CPR, you should always have a barrier mask inside of your first aid kit. So also, if they have any injuries from the fall, you would have bandaging supplies and some form of disinfectant to be able to take care of those wounds. So he did a great job in those. All right. So I want to talk a little bit about why not everybody is so apt to help. You may be wanting to help. You may ask people to help and they'll say no, or maybe they'll walk away. Or maybe they'll say, not me, not me. Okay. So maybe they don't know what to do. Maybe they don't want to screw up. Those are very, very common issues. But they could also be afraid of being sued. And anybody can be sued for anything, for any reason. That doesn't necessarily mean that a judge is going to convict somebody based off of what somebody is suing somebody for. Okay, the judge can always say no go. And in medicine in particular, when you have lay responders that are trying to help and they're acting within the best interest of the patient, and they are acting within their level of training, okay, we have Good Samaritan laws that protect them. And basically, if this was a patient that is unable to make their own decisions or receives assistance from somebody they believe has that level of skill or training, all right, they could always turn around and sue them because, oh, they did something I didn't want them to do, or they resuscitated me when I didn't want to be resuscitated. Well, if you don't have any documentation that states exactly what they want and don't want, you may wind up resuscitating somebody who doesn't want to be resuscitated. But if they don't have the documentation on them like they're supposed to, okay, that shouldn't be put on you. So no judge in their right mind is going to convict anybody of negligence when they're doing their best within their training appropriately to help somebody that it would be in their best interest if they wanted help. Okay. So if somebody obviously is able to make their own decisions and says, no, I don't want help. I don't want to go to the hospital. I don't want you to bandage my knee. You can't make them. Okay. Forcing somebody to go to the hospital when they don't want to, that's still considered kidnapping. We don't abduct people and take them to the hospital. So make sure they always give you their consent before you touch them or provide any sort of care to them if they're able to provide consent. Okay, that's called informed consent. If they're unable to give their own consent, that is called implied consent. If they're incapacitated, if they're unconscious or unresponsive, those are instances where if somebody wanted to continue living, what kind of decisions would they make? Somebody in their right mind. So that's the kind of scenario that would fall under implied consent. Now, in a first aid situation, it's very possible that you only have minutes to act. You have a very short time, and you need to decide what to do and do it very quickly in order to save their lives or, make the difference between them having to lay in a hospital bed the rest of their life. Okay. So, if this is a scenario where you need additional help and, what you have, the resources you have available to you are not what they need. Sometimes they need advanced cardiac life support. Sometimes they need ALS, advanced life support from an ambulance, from a paramedic, or they need the hospital with scans and diagnostic testing, surgery, right? So the faster that you get help coming, the better outcome it's going to be for that patient. In Michigan, on average, it takes 20 to 22 minutes for EMS to arrive on scene from the time you pick up the phone to call 911. Now, depending on where you live and what kind of resources you have close to your house, it could be more or less time. But on average in the state, it's about 20 minutes. So whatever you're doing, you got to assume you could potentially be having to hold your own with that patient for about 20 minutes. And the faster you call EMS in a life-threatening situation, the better outcome for the patient. So I keep saying life-threatening. Life-threatening means that it would interfere with airway, breathing, circulation, or ABCs, or it's some sort of extreme sign. Okay, so some life-threatening conditions: unresponsiveness. Unresponsiveness generally means that something has gone horribly wrong inside the body. Okay, altered level of consciousness, if they're not acting right, if they're acting like they're drunk and they're not, if they're confused, not able to remember things properly. Okay, that could be life-threatening. Something bad has to happen for them to be in that condition. Breathing problems, right? Because that could interfere with airway and or breathing of the ABCs. Severe external bleeding, vomiting, or passing blood. So that can interfere with circulation. If you lose too much blood, your heart cannot pump enough blood to your organs in order to let them work. So that's when you start getting shock, which is multi-system failure in the body. Any sort of signs or symptoms of a life-threatening medical condition like a heart attack or a stroke. So we'll talk more about those later, but in general, they complain of extreme headache. They may have issues with speech. For stroke, heart attack, they may complain of chest pain, difficulty breathing, nausea, vomiting, arm pain, so on and so forth. Okay, severe burns are life-threatening. It doesn't take a whole lot for a burn to become critical. You know, if you think, oh, it's just their hand, well, it's their hand, right? It's not like you dropped a little quarter that burned you on your hand. It's your hand. Even though that doesn't seem like a whole lot, it's kind of a big deal. Suspected or obvious injuries to the head, neck, or spine. Okay, that could interfere with normal life processes. If they have an obviously broken bone where it looks deformed, right, where it's fully fractured, that could definitely sever nerves. It could sever your blood vessels, okay, and easily you could bleed out. And then there's also poisoning that could be life-threatening. So if it starts interfering with airway, breathing, and circulation. And then seizures. Seizures are considered life-threatening in most cases. So we'll end right there on this video, and then we'll pick up with the next video. I'm hoping to be able to do compressions on Tuesday. We're not in class Tuesday, on Monday.